Hi everyone, I'm Dr. Ghaderi and thank you for joining us for this first ever Facebook Live event, which I just realized. Some technical things that we weren't on time exactly. This is a lot more detailed than I thought, but it's fun to do, and we're obviously learning how to get this set up. We're going to discuss non-surgical facial rejuvenation tonight, and obviously if you have any questions, please leave them in the comment section below, and Deshelle is here. If you hear her laughing, just because she's trying to keep me from going off track, but she'll help me go through any questions or comments you have. We're going to go through a Botox demonstration as well to be able to show you how I mix Botox right before you have your treatments and be able to obviously show you something behind the scenes, so-called.
What is facial rejuvenation?
Facial rejuvenation is a broad topic. It's something that we all pay attention to more now that we live longer and live better. So we want to be able to look our best. Facial rejuvenation, as far as reversing aging, is very difficult to impossible, but maintaining your youthful look for a longer period of time is really what everybody's goal is. And it's something like Botox, fillers, and even some things that you can do at home. I think we treat our teeth daily and twice daily, so you want to do the same thing for your skin. Have a regimen where you exfoliate and hydrate and be able to maintain that so-called youthful glow and be able to enjoy having your skin feel the best that it can. And as far as the men and women, the process of looking good, men do it as well. I've even tried Botox for my crow's feet, and it does work. I haven't had it for a while. So if you still notice any lines, I apologize. I just haven't gotten it treated yet recently, but it does work. And women obviously are primary users for Botox for forehead, for crow's feet, and for the frown lines.
How does Botox work?
Botox is very easy as far as the chemical goes. It works between your nerve and your muscle. So your brain sends a signal through your nerve to tell your muscle or command it to frown. But that chemical is blocked with Botox. So your brain says to frown, but you actually can't do it. So it's fun to see the first time you try it. You try to do it and your brain feels like it's happening, but it's not happening. So it blocks the nerve from talking to the muscle.
Does it hurt?
Botox has minor amount of discomfort. I would say a bug bite is a relatively good example of what it is. Again, I've had it done. Men, as you know, cannot tolerate any pain, so if I can get through it, anybody can. It's something that I would say ice helps. We use ice a lot of times. Just imagine when your hand is really cold in the winter and you can't feel it. So if you ice some area, it does numb it a little bit and it helps decrease the amount of discomfort. Very tolerable.
How often would I need to repeat Botox injections?
Usually about 3 months. Some people are about 2.5 months. Some people can go even longer, 4 to 6 months, but in general about 3 months. And the nice part is, let's just say the first time you want to try it and it's something that you're worried about or concerned about, like any other treatment, do it and it'll go away. And it's something that you don't have to repeat. But if you do want it, which what most people do, they come back every 3 months and repeat it.
Is there swelling or bruising?
Swelling, I wouldn't say, because it's very minor, and then I'll show you the needle size. But some bruising can happen, but a little bit of makeup can cover it up, and even me, that I don't obviously cover it up with makeup, the bruising is not noticeable at all, depending on obviously the process. So I'm going to show you how I mix the Botox. So the Botox is, when it comes in the vial, when you open the box, it's got a little bit of powder on the bottom that's white, and it's no liquid in there. So we have to mix it with saline. So everybody mixes it differently. I use 4 cc's. Some people use as little as 2, but some people can go up to 6 or 8 cc's. But really the number of units you get is the most important. And so about one area, let's say your frown lines, is about 25 units. And when you mix it gently, you don't want it to be something that is shaken because the toxin is fragile. And not too scary with that bigger needle. We do have a much smaller needle, and 1 syringe of this is basically what you need for one area of like frown line or crow's feet, so about 25 units. And Botox is generally used for the upper face, like your frown lines and your crow's feet. And then as far as the next topic that we're going to talk about, as far as tissue fillers go, that's generally for the lower face. The main lines to use for tissue fillers is the line between your nose and your mouth, so-called the parentheses around our face, or nasolabial lines, and then the marionette lines. Those are areas that the skin is thicker, so the tissue filler is kind of like spackle. When you inject it, you want it to be hidden by the area so you don't see it or feel it too much. Up here, the skin is very thin, like around the eyelids, so that might be more noticeable. There's certain areas fillers are definitely more effective, and I've found the thicker skin around here and here are definitely more consistent. You can have a more reliable result versus the eyelid or the lip, which sometimes can maybe look more noticeable than other ones.
What age should you be before getting facial fillers?
So fillers, you want to be more conservative. If you haven't already gotten my tone on the fillers, Botox you can start in your late 20s or early 30s, and it does prevent lines from forming, so it's very helpful over the long term. But fillers are more of an instant fix. So if you have a line that you don't like, it's instantly as soon as you put it in, it helps, but it doesn't really prevent the line from worsening. So I would say be conservative on the fillers, because it can, if overdone, distort the shape of your face, and obviously you want to avoid that.
Are facial fillers safe to get anywhere?
They are safe to get anywhere, but like I was mentioning, be conservative, because there's some areas, again, like underneath the eyelid or the lips, that sometimes can be shown to have distortion, and they're not as reliable. But let's say there's an area that you don't like, and how do you reverse fillers? So Botox, you can just wait it out, it goes away. But what do you do with fillers that sometimes can last 6 to 9 months? So there are two main products, Juvederm and Restylane, and I use Juvederm. They're both the same chemical, hyaluronic acid. There's a drug called hyaluronidase that, when injected, can break down that chemical and have it be resorbed. So if there's an area that you don't like, and obviously you want to reverse it, hyaluronidase is a good treatment.
Can fillers... we have Melanie on our Facebook Live post. She's asking, what can I do to my hands? They're starting to look old.
So hands are definitely a good question. So hands are the same thing. If you, as we all get older, we kind of lose the fatty area, and you kind of see your knuckles more on the skin. So same thing nowadays, actually, with fat transfer between the tendons under your knuckles, that can be done. So fat transfer is easy. There's not much fat that's needed, only just a few cc's. And so fat transfer would be one thing to rejuvenate. As we all age, we kind of lose that fatty fullness, kind of like our face, our hands. So for the hand, not only can you do the same skin treatments, exfoliate and hydrate, and obviously avoid a lot of sun damage in the winter, try to hydrate your skin from getting cracked, but really any surgical treatment, one of them would be fat transfer. I hope that answered your question.
Then we have Janine, Hillary, and Maria that all say hi, Dr. G.
Hi guys. Thank you all for joining us tonight. We're going to do one more Instagram. Please follow us at St. Charles Plastic Surgery, and have a great night.